Hey everybody, I'm here to talk to you about dry needling. It was initially uh, started by a physician, Janet Travell, who I think was President Kennedy's physician. He had Addison's disease, where he had a lot of musculoskeletal aches and pains, and she found that injecting things like saline with a needle into those trigger points made him feel much better. Later, they developed the theory that, hey, it's more than just the compound you're injecting, but the actual penetration of the needle that can create the therapeutic benefit. So that's where the term dry needling comes from, because there's no substances like cortisol, lidocaine, or anything like that that we're putting into you. And what's interesting is we can do that every day, whereas you can't get trigger point injections or cortisone shots every day. So it can be very therapeutic, especially when we can repeatedly do it over a short period of time. Okay, in '79, Carol Lewitt was a Czech physician. She actually coined the term dry needling. He found that inserting a needle in a trigger point without any injection often had the same therapeutic effect as wet needling. And that's where, and by the way, we do use acupuncture needles. Dry needling is not the same as acupuncture, although we use the same needles. 2000s, it became very widely adopted. And just my story, I've been in practice for almost 30 years now, and I finished up a postdoctorate diplomate program. I am double board certified. I have an additional certification that I'm board eligible. I'm just too busy to take the work. Anyway, I kind of hesitantly got involved in dry needling about 10 years ago, and didn't think, hey, how much value can this add? And I didn't know a whole lot about it, but I had a continuing medical education requirements I had to fulfill, and there was a local conference. I thought, you know what, I'm just going to take it. And it's been game changing. It helps significantly. If I'm really stuck with a patient doing all the physical therapy, chiropractic stuff we're doing, dry needling makes a huge difference and can really turn chronic cases around. So how does it work? Works by targeting myofascial trigger points that are tight, irritable knots in muscle tissue, and it alleviates pain, restores muscle function, really brings blood supply to the area. Okay, it can be very effective for back pain. This is 22 meta-analysis of randomized clinical trials found that dry needling, when combined with other, like chiropractic and PT, can significantly reduce pain intensity in patients with chronic back pain. Neck pain. 2023 meta-analysis reported that dry needling improved pain and functional capacity in patients with chronic neck pain at short and mid-term intervals, with patients over 40-year-olds benefiting more than younger individuals. Very interesting. Maybe some scar tissue there. By the way, with the back pain, I also see it very helpful. There's been some studies with lumbar stenosis, which is when you get arthritis, you kind of bone spurs in the back of the disc, and then facet arthritis, and this thing called ligamentum flavum hypertrophy, and it kind of squeezes the nerve roots in the back. And many times people need surgery for that, but it's actually very effective. Dry needling can be very effective. Spinal stenosis, there's the study I was talking about. Knee pain, a review of 10 studies found that dry needling had a moderate effect in reducing pain and improving disability in patients with patellofemoral pain syndrome. That's pain more common in women going up and down stairs or just sitting a lot. It bothers the kneecap because it doesn't sit properly in the groove. And, I've been in practice a long, long time, and we use it for everything from neck pain, back pain, sciatica, disc issues, carpal tunnel, rotator cuff impingements and tears. Tennis elbow, it works great for. Actually, it's a game changer for tennis elbow. So, okay, I hope that helps. And if you'd like to try it, give us a call. Take care.